Now we're having an introduction to the whole of pharmacology. So after we're done, we'll now be hitting the pharmacology based on individual drugs. Okay, so we're moving, and the first drug, which will be, the first group of drug which we'll be looking at today, is what is known as the diuretics. Okay, diuretics. So diuretics, in how will I put it, in summary, they are just drugs that will basically help to put out fluid from your body. So fluid is too much, so they basically help to like put it out. So diuretics, just so you know, they are drugs that increase urine output. They do this by altering the renal tubular ion transport. They are classified into subcategories, right? So different subcategories. So we have the carbonic anhydrase inhibitors, we have the osmotic diuretics, we have the loop diuretics, we have the thiazides, we have the potassium, we have the sparing diuretics. That's the potassium sparing diuretics, right? So you guys don't have to worry, because we'll come back and hit it down on these subcategories and also get to talk about the individual drugs. So what's the general principles of diuretics? So they are basically drugs that promote excretion of sodium and water from the body, and they also stop the reabsorption. So pharmacological role is mainly to treat all those hypertension, edema, like heart failure, type of edema, the liver cirrhosis, using also nephrotic syndrome. So they act on different sites of the nephron. Okay, you see it. Okay, proximal tubule, loop of Henle, distal convoluted tubules, also at the collecting duct. So major classes and mechanisms is for the carbonic anhydrase, you could see number one. Okay, don't worry about this image, right? So I brought some examples. Okay, so carbonic anhydrase, we said that example is acetazolamide. So this is acetazolamide. So they act at the proximal tubule, that's just at the starting point. This, you could see that they wrote acetazolamide, you understand? So they act there, and they inhibit carbonic anhydrase, which is an enzyme. Do you understand? So they will now be decreased by carbonate reabsorption. There will be increased sodium and water output from the body, used in treating glaucoma, metabolic alkalosis, altitude, sickness. So adverse effects is it can cause metabolic acidosis, can cause hypokalemia, can cause renal stones. You understand? When water is being excreted too much, that you are having, We also have osmotic diuretics, which act at the proximal tubule and the loop of Henle. Osmotic diuretics, number 2. Proximal tubule and the loop of Henle. Are you following? So there, we have the loop diuretics, which act at the thick arsenic loop of Henle. Drugs like the Furosemide, Bumetanide, Torsemide. Okay. Then we have the Thiazide diuretics, like the Hydrochlorothiazide and the Chlorthalidone. They act at the distal convoluted tubule. Okay. So they inhibit the sodium chlorine cotransporter. Then we have the potassium sparing diuretics, like the spironolactone and also the eplerenone. So those ones, they block the aldosterone receptors in the collecting duct. So other ones, they block the ENaC, like the amiloride, the triamterene. They are mainly used for heart failure, resistant hypertension, ascites, and prevention of hypokalemia. So their general pharmacokinetics is they are orally, most of them, they are orally active. They give it through the mouth, you understand? They are mainly used in treating hypertension, edema, heart failure, of course. Is the edema coming from heart failure, you understand? Then special cases, mannitol is used for intracranial pressure, acetazolamide for glaucoma and altitude sickness, spironolactone for what? Hyperaldosteronism.